So, good evening, everybody. Thank you so much for coming this evening as we all work together to try to find cures for cancer. My name is Maie St. John. I'm a head and neck cancer surgeon and scientist here at UCLA. And my story begins many moons ago when I was about 4 years old. And my grandfather was the lone doctor in a small town, and he took me with him to see many patients. These patients had various cancers all over and throughout their bodies, but I decided then that I wanted to work on and dedicate my life to curing cancer. And my story then took me to getting an MD and a Ph.D., and while I was during my medical school years, I rotated on the head and neck surgical service, and I was introduced to tumors that would grow in people's faces, near their eye, near their tongue, near their throat. These are places that are so important to who we are and how we kiss our children, how we communicate, that I became very enraptured with entering this field to try to help patients. One of the things that's very important when patients come to me is they ask me, for example, if I have a patient with tongue cancer, how much of my tongue are you going to take, Dr. St. John? And will you know that you've taken the entire cancer, but will you also save as much of my tongue as possible so I can continue to speak or work or take care of my children? So one morning I was driving in my car, I was backing up, and I almost hit the hedges in front of our house. And my car promptly beeped at me, beep, beep, telling me you are getting close to hedges. I thought to myself, as a surgeon, I prepare ahead of time, I order CAT scans, I order MRI scans, I examine the patient, but once I get into surgery, it is completely my clinical judgment and touching the tumor that allows me to cut it and resect it. Why can't I build a tool, like my car, that can tell me how far I am at all times from the tumor? Therefore, I can tell the patient I've resected the tumor in its entirety, and I have left you with as much normal tissue as possible. This is one of my missions in the lab. I thank you very much for your support as we continue to treat cancer together. Thank you so much.